gives me great pleasure, actually, to be here as chair. This is our second, or might have been the third attempt to meet for KI because of bushfires and then COVID. So we're here, whether we like it or not. Right, we're here. But there's some special guests I think I should recognise. First of all, Adrian Federick, who's the member for Hammond. Also Mayor Kingelly, old friends of mine, both of them, I think. Old, in your case, I think Michael. Yeah, and of course Chris McGowan, who's the CE of SA Health. And I think it's great to actually have Chris here today. Now, the governing board members, I hate to do this to you, but I must. I'd like you to stand up as I call your name. So I think you need to actually know that at least the faces of the people who have responsibility for governing this quite unique, actually, local health network. So there's Kevin Pantley. Where have I got? Judy Curran. I've got Prue Blackwell somewhere, yes. I have Roger Sexton somewhere, Dr. Roger Sexton, I should say. I have Jed Fuller, who has his first meeting tomorrow. And I have Greg Russell. Is that dreadful? But I'm excused because he's yet to have his first meeting as a director. Let's see, where do we go from there? One of the things that I also need to know is a whole series of apologies, and it's required in any public meeting. I don't wish to bore you. But the apologies we have are from federal local members of Parliament, Nick Champion, Rebecca Sharkey, Rowan Ramsey and Tony Gaston, state local members of Parliament, Tony Piccolo, Dan Van Holst, Pelican, Josh Teague, Daniel Cregan, David Basham, mayors, Anne Ferguson, Keith Parks, Moira Jenkins, Karen Redman, council CEOs, Brian Carr, Andrew Stewart, Glenn Raffensberg, Victoria Purdy, and Greg Georgiopoulos. Actually, I can't read my own writing, it's only just put into it. HAC presiding member, Jennifer Hebert. HAC KI members, Katrina Wills, Margot Smith, and Darren Fraser. Our board executive, our Gen executive, Peter Taylor, Daniel Cannon, and Sharon Morton, who at the last minute was unable to attend because of illness. KI leadership in Daniel Roessler and Nicole Holm, and Karen Gold, who's the principal engagement for the KI bushfire project. Having done that boring bit, I really want to also recognise the executive and leadership team of the local health network. I think we're privileged as a board of directors to have such a talented, skilled and experienced executive group. I'd also welcome Darren, thank you, as the presiding member for the HAC here, and the other HAC members who are in attendance today. A special welcome to the Bushfire Recovery KI Local Recovery Coordinator, Rob Manton, and the KI Community Development Officer, Catherine Kinnaman. Catherine, are you here? Oh yes, there you are, two of you. Welcome. And Margie Prideaux, who's a community member and who's going to share her experience with us a little later. On the 1st of July last year, the state government established 10 local health networks each with their own governing board. Our board members, who are all here present today, and I've introduced you to them, are a highly skilled group of individuals who bring a wealth of knowledge and experience across different specialty areas. I'm only grinning because some of us have been around a long time. Together, we're accountable for our local health services across the Barossa, the Hills, the Fleurieu and KI. Now that's a significant local health network because we're responsible for providing the strategic direction for the communities that are encompassed within peri-urban, within rural and within remote, here as in KI. And we're here today also to listen to the unique needs, views and concerns of the Kangaroo Island community. And we'll be giving you that opportunity in our question time at the end of our little chats. And on behalf of the board, I do encourage you to take this opportunity to ask questions of us. Now, while navigating the challenges presented by COVID-19 and the catastrophic bushfires, we've continued important strategic work behind the scenes. Actually, definitely behind the scenes. It's been great to get out. And it's been really interesting today. Some of us are meeting staff for the first time. And the thing I've noticed, having become familiar with their faces, I didn't know that some of them were as tall as they are. So it's been sort of going, oh yes, I think I know your face. Yes. We were unable to actually embark on a full strategic planning exercise. To do so, we would need to, well, we will be negotiating with all our communities around what they perceive to be their health needs. So, given that we weren't able to do that because of COVID, we decided to at least develop a strategic intent document. Now, you'll find that on your chairs. This is our strategic intent document. This is providing us with a way forward for the next 18 months. And it's providing us a way forward until such time as we develop our full-fledged strategic plan. It also, though, what it has done is made us focus on what our values are. And that's, for us, that's a critical matter. The values of our organisation, the values of our staff, the values that we present to our communities are so important. And I want to draw your attention to them. Trust. A safe and reliable pair of hands for all that we hold. Respect. Quality treatment and care that every person deserves every time. Integrity. Own up, open up and follow up. Collaboration. Sharing improves our caring. Kindness. Giving care and taking care in providing care. Now they're important to us, they're not just words. But what's really good about them also is TRICK, trick. It enables us to keep it in our heads, trick. Trust, respect, integrity, collaboration and kindness. I had to learn it. But it's not just learning, right? It's actually living and breathing it. That's what's important. So we refer to trick. So that's a big piece of work that we did, and we made no excuses for the fact that we didn't do broader consultation on that. As a key priority, we've also commenced the development of a community and consumer engagement strategy and a clinician engagement strategy.